Good afternoon. I'm Melanie Ross. I'm the Chief Communications Officer for UF Health, and it's my pleasure to welcome you here today. Please come forward, gather up. We're going to start our program here. It's great to see all of you here today. We are entering the next phase of a sustained period of growth and accomplishment here at UF Health, and each of you has been key to our shared success. So today is about the why we do what we do. It's about the how. How do we build on our achievements and continue to aim high? And it's about the who, and that's all of you. At its essence, we are talking about our culture, the values that are key to that culture and part of our DNA as an academic health center, home to the brightest minds in science and healthcare. And the vision we are outlining for how we will move forward to benefit our patients and our communities, our faculty and staff, and our students. To start things off, we'd like to share with you our newest video all about UF Health.
When we transform, we don't stay the same, and we don't stand still. We become something greater. The same goes for the people whose lives we touch each day: patients, their families, students, faculty, staff, the residents of our communities, and beyond. At University of Florida Health, we are forever changing, advancing science, discovering new therapies, enhancing our educational curriculum for tomorrow's healthcare providers, and improving patient outcomes. Transformation is in our DNA. From pandemics to precision medicine, to population health and more, we are relentless in our quest to solve some of the most perplexing challenges in healthcare. We teach students new ways of learning and benefit from diverse perspectives that shed wisdom on problems where ignorance once prevailed. We lead the way in interpreting data, pioneering new developments in artificial intelligence, and translating scientific discoveries into patient care advances that help people get back to living their best possible life. And we do it all with a gentle touch, a warm smile, and an encouraging word along the way. As part of Florida's modern flagship land-grant university, we are proud to be an academic health system and home to vital safety net hospitals. We lean into our social mission. After all, we're problem solvers, working together to make a difference. UF Health is a nationally renowned, top-ranked healthcare destination that attracts the brightest students, scholars, scientists, and healthcare providers ready to tackle our patients' greatest needs. We're sought after not because of our bricks and mortar, but because we take time to hold a patient's hand, solve the mysteries of what causes disease, and pass along compassion and knowledge. Why do we do what we do? Because the world counts on us to transform lives by the way we practice medicine, hunt down new treatments, identify cures through our groundbreaking research, and train the next generation of healthcare experts. We intend to deliver so that each generation is healthier than the last. There's never been a more exciting time to be part of our UF Health family. If you're looking for hope, look to us, because we are transforming lives.
And now it's my pleasure to introduce Dr. David Nelson, Senior Vice President for Health Affairs at the University of Florida and President of UF Health.
Thanks, Melanie, and thanks for all those that came out on this beautiful day. It's exciting to see everyone, but I'm very anxious as to who's actually taking care of patients and the needs of the state. So today's a special day because this afternoon we get to celebrate the achievements of what you just saw, which is our big academic health center, UF Health. We're going to highlight our ongoing commitment to our core missions and a really exciting journey that we're on together. The idea of together has been a big part of our guiding principles for many, many years. One UF Health Together will serve as our roadmap to steer our focus over the coming years as we expand our presence across the state of Florida. This next phase will help clarify what makes UF Health different and how what we do is really the sum of the parts. Our colleges, our research centers, our institutes, our hospitals, our physician practices, and our multiple campuses around the state. One UF Health Together for me represents the uniqueness of a major academic health system supported and guided by all, coming together to take care of our human and animal patients, but most importantly, assuring healthy communities in Florida. As a land-grant university that offers some of the top health programs in the nation, we're called upon to serve the needs of people throughout the state. To do that, we have to have facilities here in Gainesville that produce high-value products throughout the state of Florida. You see a lot of growth occurring throughout the state. Growth by itself is not really a reason to grow, but we're really interested in preventive care and population health, and starting to study the overall health of populations, which help us better diagnose, treat, and reach out to educate people to stay healthy. It's also worth noting that One UF Health Together isn't about just growing bigger for its sake, but growing better, growing bolder. It's really about how growth fuels the ability to reinvest in our mission. And here in Gainesville at our mothership, but really nurturing the programs we already have and all of you that contribute to that product, who are really powering our ability to advance discovery in clinical care and train the next generation of researchers, scientists, clinicians, and educators. So today marks the official kickoff of our new UF Health strategic vision, which is really the guide star, the North Star for our future. Many in this audience participated over the last year. This was an effort of all of the colleges and our hospital systems to come together with the 4 different missions and really try to once again reaffirm who are we, what are our values, what's our mission, and what you're going to see over the next year is really a rollout, so we continually reinforce our vision, our mission, and what makes us who we are. So our vision focuses on 8 overarching goals that provide a framework for strengthening integration, energizing collaboration, and enhancing impact amongst our units. They're organized in 5 areas integral to our missions: patient care, research, education, community partnership, and work environment. In brief, we seek to, 1, advance clinical excellence and equity in health and patient care and build a resilient UF health system. 2, to accelerate discovery across basic translational, clinical, and population-based sciences. 3rd, to expand research impact to address state, regional, national, and global health needs. To reimagine education and build tomorrow's workforce. And finally, to nurture top talent from diverse backgrounds. We're also presenting an expanded set of core values that you see behind me for UF Health that really unite us as a nationally renowned health system, part of this proud top 5 public university. Our core values build on the university's values and center around our commitment to our faculty, staff, students, patients, and communities. Embracing these values unites us in our efforts to transform lives and offer hope and bring us hopefully closer together. In the post-pandemic world, we've learned a lot about resiliency and the critical needs of a healthy community. It's time to reaffirm our existing values and to infuse additional emphasis on things like integrity, respect, teamwork, well-being, and inclusion, all critical for success as we move forward, and key principles that drive a healthy work environment. That's not only good for us, it's good for our patients and good for the community. At UF Health, we are forever changing, advancing science, discovering new therapies, enhancing our educational curriculum for tomorrow's healthcare providers, and improving outcomes and patient experiences. We all stand ready to tackle great challenges, present and future. Collaboration and a solution-driven focus are clearly at the core of these efforts. Together, we will become something much, much greater than current. We will transform lives, offer hope, and hopefully healing. So now it's my pleasure to introduce Dwayne Mitchell, who's many know is the director of our Clinical and Translational Science Institute. He's a professor of neurology. To me, Dwayne represents what's hard to often verbalize. What is it unique about an academic health center? What's different about here in these walls and buildings than, say, North Florida Hospital? And Dwayne, for those of you who are well aware, is looking for the cure for an incurable disease, glioblastoma, brain cancers, and really represents the science of hope. Where so many come here looking for hope for diseases or challenges that have no answers or apparent. And so there are many Dwaynes walking around this campus across all disciplines, and that's the heart and soul of what makes really an academic health center. And that's why most of us have decided to work here. Some of us spend our lives here. But it's that fulfillment of seeing science translated into education, clinical, everything community-based, that I think really gives us the heart and soul of who we are and forms the basis for what you see around our values and our mission. So Dwayne is going to speak a little bit about the impact of our research mission, and thank you again for coming, and I want to welcome Dwayne.
Thank you for the kind introduction, and it's really a great pleasure to join you today in this celebration of the UF Health vision. I've actually had the distinct honor of really being a member of the UF College of Medicine faculty now for coming up on almost 10 years. And for those past 10 years, I have really witnessed the remarkable growth of our academic health center's research capacity, its national and international recognition of those research accomplishments, and importantly, its regional, national, and global impact. And this growth has really been marked by signature investments and initiatives in our research enterprise that have been carried out and executed in collaboration with our university leadership as a whole, our board of trustees, the state as vested partners, our alumni, supporters, and then of course, all of you and all of us as faculty, students, administrators, and staff. And I would often, in the last 10 years, as I was talking and meeting different faculty across campus, I would get asked, oh, did you join UF? Did you come here during the Florida Cancer Initiative? And I would say, no, I arrived before that. And then someone else would say, oh, were you part of the Faculty 500 initiative at the University of Florida? And I'd say, no, I came before that. They said, oh, did you come under the UF Preeminence Initiative? And I said, no, I actually arrived a little before that. And every time I'd have these conversations, I would have two thoughts that I would reflect on. One was just the remarkable and sustained commitment that our university has had to the research enterprise, to the growth and the investment in its faculty and its trainees and its staff, and how central the research mission really has been to the vision of the university. And then the second thought I would have is, what did I see 10 years ago that I was so compelled and excited about? And what I can tell you is, it was really what you heard today. I heard 10 years ago a glimpse of the vision of where the university was headed, how research was central to that mission, and an opportunity to join, if I wanted to be a part of that vision and mission. And the last 10 years have really been benchmarked by the achievements and the milestone accomplishments that I heard laid out a decade ago and that many of us are hearing laid out now for the next 10 years. And the second thing that I remember that I thought was important to convey today was not what I just saw, but also felt the opportunity to be included in the community of investigators that were carrying out the research mission here at the University of Florida. And over the last 10 years, you all have become really colleagues and friends, joined in this endeavor to try to find discoveries that improve the health for our individuals and patients and community. And I can tell you that collaborative spirit and that environment of inclusivity has really been the central component and tenet that has allowed not just myself, but of course many of you, to build interdisciplinary collaborations, multi-PI grant awards, and clinical and translational research programs that don't just span the colleges here at University of Florida, but also the nation and the globe. And I think that is, I know in these times, sometimes challenging, but I think we have to remember that people thrive most where they feel that they're a part of something special, and we really have that environment here at the University of Florida in our research, education, and clinical care missions. Under the leadership of David Nelson, UF Health has really become a statewide health network, and with that, opportunity comes also the tremendous responsibility for us to expand our academic and research mission to helping to improve the lives of those communities and patients that we now take care of and touch throughout the state and the region. There are many accomplishments, and too many to name, that our research efforts have had as an impact on our community. But as example, in partnership with the UF Health Cancer Center and under the leadership of John Licht, we've catalyzed advancements in immunotherapy, in targeted therapeutics, in health communications, and in microbiome research that have all led to first-in-human clinical interventions, interventional trials, and ongoing clinical studies, and several multi-institutional investigations under those initiatives. The integration of the Herbert Wertheim UF Scripps Institute for Biomedical Innovation and Technology, along with partnership with the leading regional healthcare system in Jupiter Medical Center, has really opened the doors for tremendous new opportunities in discovery, basic, translational, and soon-to-be clinical research opportunities for our faculty and trainees here at UF Health, along with the established and growing research enterprises already operative at the UF Health Jacksonville and UF Health Villages campuses. This is really an extraordinary time for those of us who are engaged in biomedical research to take full advantage of the capacity of this tremendous university to advance meaningful change. One of the most exciting opportunities that I see ahead, as well as challenges for us as a research community, is how can we most effectively and strategically socialize and align the tremendous talent and capacity that we have with the priorities and the pressing healthcare needs of our communities and also of the nation and globe. We've all experienced and we'll continue to work through some of the more challenging times in our recent history that have tested our resilience, our mental well-being, and our work-life balance. And at the same time, the needs for innovative solutions to our most pressing national and global healthcare challenges and opportunities for innovative transdisciplinary research have never been greater. And so UF Health, through its integrated efforts of the members of our health colleges, as well as the expansive healthcare network, is really optimally poised to turn science and discovery into health and improved outcomes for patients in our communities. And through trusted partnerships with all of us, as well as bidirectional communication with our community members, I could not be more excited about the next 10 years than I have been about the prior 10 years. I'm really thankful to be a part of this journey with all of you, and I appreciate being able to celebrate that journey today. I now have the pleasure of introducing our next remarkable speaker. This is Natalie Ateo, who is a dental student. She is from Parkland, Florida, and she graduated from Duke University, go Blue Devils, with a degree in Spanish. She's in her last semester right now of dental school and will graduate in May with not only her dental degree, but also a PhD. And her dual degree training is really offered through the unique collaboration between the Colleges of Dentistry and Medicine, and it is just one of the many examples of the strength of the interdisciplinary environment here at UF Health. So I'll let Natalie tell you more. Thank you.
Hi everyone. I want to begin by saying I'm very honored to speak to you all today about the education component of the UF Health Strategic Plan. As you heard, I'm a dual degree student, so I'm getting my dental degree in the College of Dentistry and my PhD in the College of Medicine through the Biomedical Sciences program. And so, as a 7th year graduate student, education is particularly close to me. Something I've really valued about my experience in both dental school and in graduate school is the huge emphasis on working across disciplines. So I've learned from faculty across all 6 health colleges on the health sciences campus, as well as collaborated with students from all 6 health colleges. And I could do that all without leaving the health sciences campus here in Gainesville. And the interdisciplinary nature of the UF Health system, I feel like has really strengthened my clinical skills and really makes me confident about providing really comprehensive care to patients in the future. And then from a research perspective, I've had the chance to present my work to extremely diverse audiences within the UF Health system, and that's really made me think about how my project, which is focused on viral infections in the oral cavity, can fit into the overall realm of patient care and health of our Florida residents. So I think the spirit of the One UF Health Together vision is really embodied in our DMD PhD program. It's actually really unique in that I'm able to pursue both degrees simultaneously. So in this hybrid model, I can be treating patients in the student DMD clinic in the morning, and then in the afternoon, I could be running experiments in the lab. And this really wouldn't be possible without the seamless integration of the different health colleges in one health sciences campus. And this is really how the University of Florida is reimagining health education. It's an environment where research informs practice, and then our clinical experiences then guide research. And I'm really excited to take the training that I've had at the University of Florida to the National Institutes of Health next year, where I'll be working as a dental clinical research fellow. And I'll end by noting that I'm just one of thousands of students, residents, fellows, all of whom are being trained in the UF Health system. And these are the next generation of providers and also researchers who will be improving the oral health and overall health in the future. So I'll end by thanking you all for being here, and I'll also introduce our next speaker, who is someone who truly lives our values and our mission on a daily basis. As our Vice President of Nursing and Patient Services, Dr. Irene Alexaitis creates an environment that enables providers throughout UF Health to bring forth their passion of caring for our patients.
Hi, good afternoon, and thank you all for being here today. What a tremendously exciting time to be a care provider at UF Health. And it will get even more exciting as we move forward with our renewed vision that Dr. Nelson has spoken about. One of the hallmarks of an academic medical center is the passion every care provider brings to each patient as we strive to deliver outstanding care to each person who comes through the doors. As an academic medical center, we have the privilege and the opportunity to provide innovative, leading-edge quality care. I witness the expertise, compassion, and caring every day as our staff interact with patients and their families. At UF Health, we care for a very diverse population, from neonates to the elderly. Each patient has special needs, and each patient receives the individualized care tailored to their needs and special circumstances by our dedicated staff and clinicians. This is what truly makes a positive difference for our patients. In addition to that passion, caring for patients allows us to demonstrate our organizational values, those values that Dr. Nelson spoke about. By integrating each of them into our daily efforts to help our patients, we're able to connect with them, their families, and beyond. Additionally, it demonstrates to our community and everyone else who may come in contact with us or our patients that we're here for them, not just to meet their health needs, but in a way that shows we care beyond just their health status. There is no greater gift for us as care providers. I look forward to the next 10 years here. Now, it's my pleasure to introduce our next speaker, Matt Benavides. He has the extraordinary perspective of experiencing U.S. Health as a patient and as an employee. Matt?
Hello, I'm Matt. Want to start off by saying it's an honor to be here. The theme Life Transformed is fitting with UF Health. This hospital and those I've crossed paths with, both as a patient and now as a team member, have transformed my life beyond imagined. November 7th, 2020 is a day I'll never forget, and to be honest, the best day of my life. On this date, I was hit on my motorcycle and was a traumatic arrest and failed and pronounced dead at 1956. I was in my senior semester at UF with aspirations of becoming a critical care anesthesiologist. It is the best day of my life because of all the strides everyone at UF Health did for me that night and continue to do for me to this day. From the moment I arrived at UF Health as a patient, all of UF Health's values were displayed. Excellence was displayed and shown from those that worked on me in the trauma bay, the OR, 4 West, and rehab. By keeping me alive, making me healing me, and giving me a second chance, and allowing me to prove all the medical textbooks wrong at the odds someone with all of my injuries has. Accountability was shown by OT, SPT, and PT by working with me daily so I could sit up again, walk again, brush my teeth again, and everything else that seems easy and normal. Compassion was shown to me and my family every second of every day. The values if it wasn't for the values and the high standards and high patient quality that UF Health holds to themselves, I highly doubt that I would be here today, let alone talking to y'all today. Being a part of the team and the family now of UF Health is both humbling and rewarding. I call 4 West my second home, not only because I was a patient there, an intern there, and now a patient support tech there while I'm getting ready to go to med school, but because I look forward to my shifts every day. Everyone in that unit, everyone at UF Health shows compassion. Everyone is also very welcoming and very motivating for me. If they see me on my break during my lunchtime, and I'm studying, they come in and motivate me. I have nurses ask if I could talk to patients or family members that are kind of going through a hard time and want to see an outcome that is possible with the care that UF Health can provide. Dr. Rosenthal and Dr. Portu have given me the opportunity to shadow them, learn from them, and have given me a guide in the right direction to becoming an extraordinary physician just like themselves. And I'm very thankful for them and everyone. It is such an honor to be able to walk the same halls, react, and learn from all of those that saved my life. And I hope I get to continue my education here by attending UF College of Medicine, intern here, resident here, fellow, and attending all at UF Health. UF Health in Gainesville is forever my second home because I have no plans on leaving, and that is how and because of why UF Health transformed my life. Thank you.
Thanks, everyone. I think we're going to add a new value. For me, it's gratitude, kind of seeing who represents our students, our staff, our faculty, just makes me very grateful to be so lucky to represent you all to the public. So just very thankful and grateful for all of you who make UF Health what it is and will continue to become. So with that, the program's over. I was asked to make sure Albert is somewhere around for pictures. There's food. I think cornhole. I heard the deans are going to have a cornhole match. So enjoy, and thank you all for stopping by to celebrate our new values. Thank you.